Hey, what's up everyone? Dr. Mike here, and if you're watching this, you're probably as passionate about clinical pharmacy as I am about medicine. Let's get started. Alright, let's start by tackling a big one. Chronic kidney disease, or CKD. This isn't about your kidneys throwing a sudden tantrum, it's more like a slow, silent decline in their ability to do their job. We're talking months, even years of damage. The usual suspects are often to blame: diabetes and hypertension. CKD is classified into 5 stages, based on how well the kidneys are filtering waste products, measured by the glomerular filtration rate, or GFR. Stage 1 is mild, while Stage 5 is the most severe, often requiring dialysis or a kidney transplant. Managing CKD is all about slowing down the progression and preventing further damage. That means getting those blood pressure numbers under control, managing diabetes, and making some dietary modifications. As pharmacists, we play a vital role in medication management, making sure our patients are on the right drugs and the right doses to protect those precious kidneys. Early detection and intervention are key. By catching CKD early and managing it effectively, we can help our patients preserve their kidney function and improve their quality of life. Regular checkups and monitoring are crucial, especially for those with risk factors like diabetes and hypertension. Now let's switch gears and talk about acute kidney injury, or AKI. Unlike CKD, which is a slow burn, AKI is more like a 5-alarm fire. It's a sudden and rapid decline in kidney function. But here's the good news. With prompt treatment, AKI can often be reversed. Anything that disrupts the flow of blood and oxygen to these organs can throw a wrench in the works. We're talking about things like severe dehydration, certain medications, and severe infections like sepsis. AKI can be classified into 3 main types: pre-renal, intrinsic, and post-renal. Managing AKI is all about speed and precision. We need to identify and address the underlying cause ASAP. That might involve giving IV fluids for dehydration, stopping any offending medications, or treating an infection aggressively. As pharmacists, we're the medication experts. We need to be on high alert for any drugs that can potentially harm the kidneys, especially in patients who are already at risk. Think of AKI like a medical emergency for the kidneys. Let's dive deeper into the world of nephrology and explore those microscopic filters within our kidneys. The glomeruli. When these tiny structures get damaged, it can lead to a whole cascade of problems, collectively known as glomerular disorders. Nephrotic syndrome is characterized by heavy proteinuria, hypoalbuminemia, edema, and hyperlipidemia. On the other hand, we have nephritic syndrome, another type of glomerular disorder. Instead of being leaky, the glomeruli in this case are inflamed and irritated, leading to blood in the urine, high blood pressure, and some mild proteinuria. Glomerular disorders can be primary or secondary. Managing glomerular disorders is all about identifying the underlying cause and treating it appropriately. Corticosteroids are often used to reduce inflammation, while medications to control blood pressure and cholesterol may also be necessary. Think of the glomeruli as delicate filters that can be easily damaged. By understanding the different types of glomerular disorders and their causes, we can provide our patients with the best possible care. Chapter 4: Polycystic Kidney Disease, a Genetic Legacy. Let's talk about a genetic condition that can have a big impact on the kidneys. Polycystic kidney disease, or PKD. In PKD, these organs are covered in multiple fluid-filled cysts. PKD is a genetic disorder, meaning it's passed down through families. These cysts can compress and damage the surrounding kidney tissue, leading to a decline in kidney function over time. PKD can also lead to complications like high blood pressure, kidney stones, and cysts in other organs. Managing PKD is all about staying one step ahead of the game. With early diagnosis, careful monitoring, and proactive management, we can help our patients with PKD live longer, healthier lives. Chapter 5: Renal tubular disorders, when balance goes awry. Let's move on to a group of conditions that affect those microscopic workhorses of the kidneys, the renal tubules. These tiny tubes are responsible for fine-tuning the composition of our urine, reabsorbing essential nutrients and electrolytes while getting rid of waste products. When these renal tubules aren't working properly, it can disrupt the delicate balance of fluids, electrolytes, and acid-base levels in our bodies. One such disorder is renal tubular acidosis, or RTA. In RTA, the kidneys can't quite get the pH of our blood right. Then we have the Bartter and Gitelman syndromes, which are two rare genetic disorders that affect salt reabsorption in the kidneys. Managing renal tubular disorders is all about correcting the underlying imbalance. For RTA, this might involve medications to neutralize excess acid in the blood or supplements to replenish bicarbonate levels. Patients with Bartter or Gitelman syndromes often need lifelong electrolyte supplementation to keep those levels in check. Think of the renal tubules as the fine-tuners of our kidneys. With careful monitoring, appropriate medication management, and lifestyle modifications, we can help our patients with renal tubular disorders live full and active lives. Chapter 6. Kidney stones, a painful reality. Let's wrap things up with a common and incredibly painful condition. Kidney stones, also known as nephrolithiasis. Kidney stones form when certain substances in the urine like calcium, oxalate, or uric acid become concentrated and crystallized. These crystals can then clump together, forming those infamous stones that can range in size from a grain of sand to a golf ball. The pain associated with kidney stones is no joke. It's often described as one of the most intense types of pain a person can experience. Managing kidney stones involves a multi-pronged approach. First and foremost, we need to tackle the pain. Over-the-counter pain relievers like ibuprofen or naproxen can help, but sometimes stronger prescription medications are necessary. Increasing fluid intake is also crucial to help flush out those stones. We also need to figure out what's causing these stones to form in the first place. By understanding how they form, recognizing the symptoms, and taking steps to prevent their recurrence, we can help our patients avoid those excruciating pain episodes and keep their kidneys happy and healthy. So there you have it, a crash course on the most common nephrological disorders. As clinical pharmacists, we play a critical role in the management of nephrological disorders. By working collaboratively with physicians, nurses, and other healthcare professionals, we can optimize patient outcomes and improve their quality of life. Until next time, stay curious, stay informed, and keep those kidneys healthy.